Sunny Eappen arrived in Burlington around Thanksgiving from a top position at Brigham and Women's Hospital in Boston. Dr. Eappen is now in charge of Vermont's largest medical system, UVM Health, which serves over 1 million patients in 2 states each year. And it's under pressure from regulators and insurance companies and a tough labor market. This morning, Eappen's first in-person television interview since taking the job. Dr. Sunny Eappen, CEO of the University of Vermont Health Network. Great pleasure to have you. Thank you.
Thank you for having me.
Well, we're thrilled to have you. Sunny is your nickname?
It has been for as long as I can remember, since high school, certainly.
Which stands for?
Sunny stands for a sunny personality. The real name is Sunil, S-U-N-I-L, Sunil.
And you're from Chicagoland?
Born and raised.
And but you come to Burlington from Brigham and Women's in Boston.
That's right.
Anesthesiologist by trade.
Correct again.
But here you are in Vermont now leading a major health network of 6 hospitals in New York and Vermont. I imagine you've gotten to know the ferry pretty well by now.
I have. I've been back and forth many times already.
Yeah, meeting with employees.
I've met with the leadership, met with the boards, met with the employees, starting to do some town halls across New York and in Vermont.
So 3-4 months into the job, is it about what you expected?
It is. It is. I think the financial situation has been difficult, but not unexpected. It's the way it is across the country around the challenges that all of our hospitals are having. What's been a fantastic, even better than expected surprise has been how great people have been. That is that our staff, our caregivers are completely committed to our patients. Our leadership is committed to our communities. That's been incredible and incredibly positive.
Although of your hospitals are facing inflationary challenges, we heard through the pandemic about the imperative of paying nurses, for example, more money, and you did. How is recruiting? How many vacancies? Have you turned a corner there?
I don't feel like we've quite turned the corner. It's a slow, gradual corner that we're getting to. We've made a lot of progress. We have hired more than we've ever hired before. The challenge remains that the number of people that are working, nurses, doctors, other caregivers, has really changed, both here and across the country. And so this is a challenge that's going to exist with us for the next 5-10 years, and we're going to have to come up with different ways to provide that care. And it can't be utilizing a temporary workforce, which is what everyone's realizing, right? Because it's just much too expensive.
Have you cut your traveler expenses significantly?
No. If we compare to about a year ago, we're probably 10% lower than we were last year. So we still have a lot of work to do in that front.
I'll come back to that, but just on the collective bargaining, I was reading in the New York Times the other day that that doctors may be the next to unionize. Is that something? What does that say about where we are in healthcare?
It's a complex question. So when you look at the unionization, and as more and more of our employees get unionized, it encourages more to get unionized, because when you've got a limited budget and you're forced on one side to pay the union employees, others that are on the other side feel like they're not getting their fair share. So it wouldn't surprise me if we get more and more unionization, certainly in our state.
Well, in the news of late, United Healthcare, one of the commercial insurance companies, full disclosure of which employees at this television station subscribe. There's a divorce in the works. As of April 1st, it seems that United, a huge national health insurance company, small here relatively, just a couple of thousand, 2,000 or 3,000 subscribers, I understand, but they say you've become too expensive, and they are no longer going to have a contract with you for in-network. What's that going to do?
Yeah, so first of all, I'm sorry for all of our patients. I'm sorry for all of your staff here. That's the worst thing from our point of view is what happens to our patients on that. I want to unpackage all the things that you said. So United is huge, number one. They're about 100 times bigger than the University of Vermont Health Network. So when we think about the relative size, yes, they might be small here, but they're a national company. The second part is that we would love to continue this relationship with United. We're still willing to talk. They left the table, and we're very disappointed in that, and we'd still like to be able to reach an agreement. Even for the small part, which we tried to do, which was to extend coverage at last year's rates through the end of the year for the sake of our patients, for the people just like you and your staff. So even for that, I think it would be worthwhile to be able to continue that conversation.
Did you offer that?
We did.
And?
We did. They walked away.
They say, and there's a statement, and we'll put it on the screen, that after receiving a nearly 20% increase in reimbursement rates over the last 3 years, UVM is now proposing 15% price hike in 1 year. And folks can't afford that.
So they're correct. We were proposing 15%, which, as you know, we're pretty regulated here in our state. So we can't typically ask for anything more than what the Green Mountain Care Board will approve. And so that's the first thing you have to realize, is that we're looking at what other insurance carriers have paid because it's a reasonable ask here. We remain one of the lowest cost networks in the country. So we're there. We don't think that we're more expensive. And you have to remember, the carriers have an option of how they want to transfer those costs, right? They don't have to transfer them to the patients. United's got enough money that they could cover the vast majority of that cost. They don't have to pay that. I mean, pass that over to their customer, to their patients.
On April 1st, a United patient, though, still can walk in the emergency room.
Absolutely. So it's really important to realize, if you need emergency care, please continue to go to the right place. If you've got care that's in process, so you're getting cancer treatment, or you're pregnant and you're planning on delivering at the University of Vermont Medical Center, that will continue, right? And your care continues. You become out of network, so it's up to you to decide then.
You just pay more.
That's right.
Speaking of cancer, the hospital announced a pretty exciting CAR-T therapy for some cancer patients the other day. That looks awfully promising.
It's fantastic. It's proven. What's really promising and what's great is that we're offering it right here in Vermont, so you don't have to leave the state to get this state-of-the-art coverage. It just speaks again to the value of having a University of Vermont Medical Center, a tertiary academic center here in our state, providing care as part of our network. It's just the right thing and a great thing for Vermonters and Northern New Yorkers.
This is, though, just for blood cancers to start?
Yeah, it's largely for lymphomas, and that's because the technology of these T cells and taking them out and targeting them to the cancers has been focused on that. But as that continues to grow and improve, we're going to continue to provide that care. Our cancer center is only going to get bigger and better, I think, over the next few years.
The Health Network has proposed a pretty expensive new outpatient surgery center on Tilley Drive in South Burlington, a $130 million proposal pending before the Green Mountain Care Board. You need a certificate of need to proceed. Is this going to improve efficiencies, reduce costs per operation? What? I mean, where's the money going to come from?
Yeah, so great questions. So first of all, we are just starting off with part of that is just replacing some very old operating rooms that we have in Fanny Allen right now. So we just need to replace those. We've had trouble keeping them open and going because of the age, and we've had to close them at least twice in the last couple of years, which is incredibly disheartening for our caregivers and worse for our patients. So part of it is just replacement. The other half of it, though, is that we know as we look ahead, just looking at our catchment area, by 2030, we're going to be short about 4,000 surgeries a year, meaning that we don't have the capacity or capability to do it. So as we look ahead, we know we need to do this for Vermonters. It will be more efficient. It is going to be designed to be ambulatory and be really efficient. We don't have that facility today. So that means that things get done faster. They get done in a way that's most cost conscious for those patients. And patients can come in and out of there much quicker. And so can our employees, actually. So it's going to be a win-win in every way for our organization and for our community.
You're also getting into the housing business, which really tells you everything you need to know about the housing crisis Vermont is now facing. But that apartment building for your staff about to open, I bet you didn't really want to have to do this.
Yeah, you know, it's one of the things that I think we realize in healthcare is that we need to get more involved in our community than we just typically what we thought of as providing healthcare to our customers, to our patients. So we know that we have many people, even on the temporary workforce, that would like to continue to stay here, and when they can't find housing, they leave. And they have a relatively short time to find housing. So we're hoping that this will be a bridge, not just for our nurses, but for every level of employee to be able to come and find a place to live while they're looking for a more permanent place.
So this is 60-odd apartments opening this spring.
60 this spring, maybe another 120 next year, with childcare associated with that for the next opening.
COVID-19, which has dominated our consciousness the last 2-3 years, you have very few patients in the hospital right now with coronavirus. Yeah. Why? What's happened?
So I think it's probably a combination of things. One is I think we've done a really good job in the state at getting people vaccinated and people being more careful than they ever have been. But I think also the virulence of this variant has been less than people thought. And so despite the fact that we anticipated a much worse winter, we've gotten off quite well. So we're just counting our blessings on that. I don't know what next year's going to be like. We're always ready.
But this is a surprise, isn't it?
This is. Across the country, it's been a surprise.
Your goals for the new year, I understand you're still really at the starting gate, but yeah. Where would you like the health network to be in a year?
So I'd like us to be financially stable. That would be a big step up. It's really important for our organization and for our community to recognize that we need to make a positive margin. And the reason that we make a positive margin is because we need to invest both in our infrastructure, the actual building and boilers and roads that are associated with it, equipment, but also for our employees, that we have to invest back so that we can get the very best nurses and doctors and caregivers. So that margin piece is really important. So I hope by the end of the year that we've turned the road. We haven't yet, quite frankly. We lost money last year, and we were in the first quarter heading down a path of losing even more money. So we're going to have to do some things differently to change that. But the other part that we're really working on is the culture, and to remind folks that as we become a network and we get more integrated, the reasons that we're doing it are so that we can better serve Northern New York and Vermont. And that means that we have to create an environment where people love to come into work. And so that's the message that I've been sending to all of our leaders, is that what do we need to do to create that environment where people want to come into work? How do we remind folks that are in the back offices doing billing or cleaning the floors that the reason that they're here is about our mission? And everyone that's doing that, the reason that you're doing it is to take care of your family members, to take care of your neighbors, and deliver better care for them. And so to kind of go back to the roots of the work that we're doing and why we're doing it. And so we've spent a lot of time when I'm at the town halls talking about that exact thing. How do we deliver the right care at the right time to the right people, with the right folks and the right medicines? And how do we do that in a way that is really efficient so that we can do that for all Vermonters across the state?
Dr. Sunny Eappen, CEO of the University of Vermont Health Network. Thanks very much.
Thank you. Thanks for having me.
Good to have you.